This is a whole different level to anything we've seen before. They're wearing super advanced masks, much nearer to a gas mask than we normally see our hospital staff wearing. Their thick waterproof suits means the doctors and nurses are sealed in. This Naples Infectious Diseases Hospital now only treats COVID-19 patients. Incredibly, so far at least, not a single member of the medical teams has been affected. It can be done, you just have to have the right gear and follow the right protocols. There's a rush on here. The patient inside is deteriorating fast. A nurse prepares an injection outside the treatment room. He never goes inside, communicating through windows to colleagues with the patient. And they never come outside during crisis moments. And this is one. When it's ready, the medicine is passed through a compartment door. Remember, he's not been inside and hasn't touched anyone or anything. But he immediately removes his gloves and scrubs down. This is an absolute constant.
Basically, it's a hospital trust that is dependent upon all of the hospitals working together because the capacity is already pretty much full. And they just accept that if it gets worse, they'll just have to deal with it, but nobody's really sure how. And the numbers are rising, there's no doubt in that. And again, critically, they're getting younger. No doubt about it. Here they're saying it doesn't make any difference if you're young or you're old, you're going to get it.
The lag between the epidemic sweeping through northern Italy and overwhelming the healthcare system there before progressing to the south.
How important in the process is physical connection?
Finally being able to physically connect with another man in recovery is what saved my life. Towards the end of my run, I was pretty isolated and pretty alone. And the studies that we're seeing that, the addiction rates are driving up across the country because of isolation.
For someone who is going through recovery, how do you do that when you don't have that physical class or that physical contact with people?
I was talking to somebody the other day about how difficult it was that first year to stay sober with all the tools and all the connections that I had. And for the people that are new now, this current issue that we're having is extremely unique and unprecedented. We're seeing a rise in people coming to treatment right now. The beds are filling up across the country. It's harder to stay out there. It's harder to stay sober. You have people relapsing at crazy rates. Mental health right now is very, very difficult to deal with, and it's a scary situation as far as what I'm seeing as somebody who works in the treatment field. These recovery meetings have kind of gone from being in the rooms and in person to switching over to like Zoom and stuff like that. My friends have been participating in these online recovery meetings, and they're like an hour, 2 hours a day, but for the other 22 hours in the day, what are these people doing?
This morning, as you see, we're coming to you from our homes out of caution over this coronavirus outbreak. President Trump says following social distancing guidelines is, quote, a matter of life and death, and we are getting that message. He spoke yesterday as the White House made a grim prediction that up to 240,000 Americans will die during this pandemic. Officials expect major spikes in the death toll during the next 2 weeks. Tony, goodness, that is news nobody wants to hear, and that's why it is so important to follow the rules.
Yeah, that's right, Gail. And of course, this is a health crisis, but it's also an economic crisis. And today is the first of the month, and that means bills are often due. Millions of Americans now suddenly trying to make a decision. How are they going to pay them? Should they pay them? We remind you that the Federal Reserve Bank of St. Louis, a federal economist, estimated that 47 million Americans could lose their jobs as companies affected by the virus cut their staff. Millions have already lost their job.
Meanwhile, CNN anchor Chris Cuomo, whose brother Andrew is the high-profile governor of New York State, said that he has contracted the coronavirus and will keep broadcasting from self-isolation in his home. The New York governor, who has ribbed his younger brother during interviews, mentioned the family situation during his daily press briefing. Let's listen in.
Your opponent, and we underestimated this virus. It's more powerful, it's more dangerous, than we expected. And the third point is plan forward. Get ahead of it. Get ahead of it. Fight the fight today, yes, but anticipate the next battle and plan for the next battle. And the main battle is at the apex. We're still going up the mountain. The main battle is on the top to this virus. It is the great equalizer. I don't care how smart, how rich, how powerful you think you are. I don't care how young, how old. This virus is the great equalizer. My brother Chris is positive for coronavirus, found out this morning. Now, he is going to be fine. He's young, in good shape, strong, not as strong as he thinks, but he will be fine. But there's a lesson in this. He's an essential worker, member of the press, so he's been out there. If you go out there, the chance that you get infected is very high, at his wife and his kids. But the reason I raise it is he's smart, he's social distancing, yes, but you wind up exposing yourself. People wind up exposing you, and then they find out they're positive a couple of days later.